Okay, so prior to moving into that second stress emotion, the second one is the flight, FLIGHT, flight emotion, fear. I wanted to do a short presentation on this topic of anxiety. And let's just go ahead and look at how anxiety is defined. Um, this first bullet point, number one, anxiety refers to anticipation of a future concern and is more associated with muscle tension and avoidance behavior. So, this is a definition that I think is from the National Institute of Health. Um, I don't know that it really helps us understand a whole lot about how anxiety might feel, what it really is. But one thing that I do want to clear up right now is that there is a difference between feeling anxious and having anxiety. And what this presentation is more about is that health condition, anxiety. Most of us at various times in our life will feel anxious about something or feel some anxiety. But, in some cases, anxiety turns into what we could think of as a health condition, a mental health condition. And with this, in this particular case, it's actually diagnosed. It's diagnosed by a professional. And, if we look at this second item here, anxiety disorders affect nearly 1 in 5 American adults each year. So 1 in 5, that's pretty close to 20%. The percentage that you usually see at the National Institute of Mental Health is about 18% of our population at any given time is diagnosed with an anxiety disorder. So, back to this definition, let's see if we can maybe create a little more clarity on what the difference is between feeling anxious, which I think most of us are familiar with, and actually having anxiety. Number three, anxiety disorders differ from normal feelings of nervousness or anxiousness. And part of that different feeling is it's excessive. It's very intense. When a person is actually suffering from anxiety or an anxiety disorder, it can feel difficult to just get through the day. Most things are going to feel very overwhelming. Um, the kind of the emotional tone of an anxiety disorder is more so just a raw fear. And with an anxiety disorder, your good mind is still there. And it's, very possible that you know that this level of fear doesn't exactly make sense, that it's excessive, it's out of proportion, in fact, to the situation. But no matter how much you may realize that, or even tell yourself it's okay and that everything's going to be okay, um, that feeling of raw fear and overwhelm just persists. Um, So, the other thing that is included in this definition at the top, it says avoidance behavior. There can be a real tendency to avoid. Um, or also down here, you see the word dread. So there can be this real tendency to dread most things or avoid most things. And a lot of the time, what that avoidance and dread is about is that everything just feels so difficult. Um, and so the dread is wow, I'm just dreading or I don't want to go and do that because it just feels somehow too much. It may feel too scary. It may feel too difficult. Um, I know personally, I've had an experience with an anxiety disorder. I was diagnosed in my early 40s with an anxiety disorder. And I can remember, really every moment of the day just feeling this really raw, unusual kind of level of intense fear. Um, it became very difficult for me to venture out and do things. Um, Everything just felt completely overwhelming, and I knew that it did not make sense, but no matter what I did, I wasn't able to shake that feeling. Um, so let's look at this next slide. It says, in general, for a person to be diagnosed with an anxiety disorder, the fear or anxiety must, and I've talked about this a bit, the anxiety must be out of proportion to the situation. Um, so feeling much more fear, worry, overwhelm, nervousness than really what the situation would warrant. It's also possible that this level of fear or worry could be viewed as age inappropriate. Um, I know for me, when I had, you know, the really difficult time with anxiety, I used to say I felt a little bit like a really young kid who didn't feel confident navigating adult life. So mine was, you could have looked at it as being a little age inappropriate. Um, Anxiety, if you actually have an anxiety disorder, um, it's going to definitely interrupt your ability to function normally. And that's a part of the diagnosis. It has to be interrupting your ability to go about your daily life, maybe to perform your work, or, as a student, maybe interrupting your ability to be able to go to class or to perform homework. And, again, diagnosis is made by a professional. So you can't just go online and take a quiz or take a test to determine whether or not you actually have anxiety. Um, it's very important to see a doctor and be evaluated. And I generally will say I think it's a good idea to actually see a person who specializes in this area, a psychiatrist or maybe a psychologist or a counselor who can help you determine what course of treatment might be best. Um, so yeah, this is a condition that it can feel incredibly challenging and really disrupt our lives, shake our confidence a lot. It's it can it what's interesting, this cartoon says my anxieties have anxieties. With anxiety, there's that element of fear, but then what can also happen is you can become afraid of the fear. So, one last thing on anxiety, I wanted to mention it's recommended that with anxiety that you seek help um, more so immediately. The problem with not getting help is that the condition can get worse, and your chances of overcoming it and improving are it's it's very advantageous to seek help early. So this is something that you don't want to sit on and wait and just hope it gets better. Um, so hopefully, um, that's made things a bit clearer on the difference between feeling anxious and actually having the health condition anxiety. And what we're going to look at next um, is panic attacks. Now, I want to be clear here. Panic attacks can happen to individuals who do not have anxiety. A panic attack can happen if a person has become just overwhelmed with stress, or sometimes they happen for no apparent reason. So a panic attack doesn't necessarily mean that you have an anxiety disorder. However, um, it is a very, very important that if you have a panic attack, to go see a doctor, because a doctor is going to want to take a look at you and make sure that there's nothing physical going on. There are no physiological problems that could be the source or the reason for the panic attack happening. And then also, if a panic attack is occurring, it might be a good idea to start, if panic attacks are occurring, it might be a good idea to really, really start giving more attention to life skills and how a person is coping with stress, and also how to better take care of ourselves. Um, so, what is a panic attack? And I want to start by saying when I talk about this topic in class, what I generally will find is at least 50% of the students in any class have experienced a panic attack. And so, panic attacks don't seem to be incredibly uncommon, unfortunately. And if you happen to have challenges with them, you're certainly not alone. Um, and, I think that most of us have some awareness of what panic attacks are. How panic attacks get defined is as a sudden episode of intense fear. So, um, a sudden episode. And what's interesting about panic attacks is they can kind of just come out of the blue, sometimes for no apparent reason, or when there's no real danger or stressor actually occurring. So you could be sitting in a movie theater, maybe even watching a comedy and have a panic attack, or it could be you're driving on the freeway. So it just kind of can come on for no apparent reason, or it could come on if you're in a situation and you're feeling very stressed out about it, for example, maybe taking a test. So it's a sudden episode of intense fear that triggers a severe physiological or physical reaction. So what's happening with a panic attack is the fight or flight response has indeed kicked in. And it's kicked in a more serious way. And so let's look at some of the symptoms of a panic attack. Now, these are physical symptoms, most of them. I want to stress, though, that the emotional component that's occurring during a panic attack is usually extreme fear. There's a tendency to sometimes feel like you're going to, that you might be dying or losing control or going crazy, or um, that something is very wrong with you. A lot of people, when they experience their first panic attack, do end up going to the emergency room, because some of the physical symptoms can feel a little bit like you've had something go wrong with your heart. And if we look at these physical symptoms, sweating, shortness of breath, racing heart, chest pain, chest discomfort, these are really good reasons to be going to the doctor. When you experience something like this, feeling dizzy, lightheaded, or faint. Um, so again, it's really important to see a doctor. if you've had a panic attack, because they're going to want to check you out and make sure everything physically is okay. Um, and, at that point, that's when a doctor may begin to talk to you about whether or not this was perhaps a panic attack. And by the way, sometimes people refer to panic attacks as anxiety attacks. Um, so, they get called a couple of different things. With a panic attack, and I'll just share, for me, some of the symptoms that I would experience. And, the first one was generally I would feel this sense of heat or warmth coming up through my body. Okay. I would feel dizzy and lightheaded. I would experience a lot of fear. I would start sweating, usually pretty profusely. My vision felt like it narrowed and like I was perhaps going to pass out. I'm sure my heart was beating, very fast, but that's one that I didn't notice as much. I also would feel kind of just nauseous and like I was going to get sick. So, and yeah, I can really relate to this, that fear that's going on that am I going crazy? What's wrong with me? It was just, it's a very scary kind of experience. And I'll generally ask students in class, well, how long does a panic attack last? And it's very interesting because I get a lot of different responses to this. Um, I've had students tell me that they've had panic attacks that have lasted all day. I've had other students say, oh, maybe 5 minutes. And, in general, the attack itself kind of, you know, it's going to depend on the individual and how they cope with it. Um, But, in general, a panic attack may last 5, 6 minutes, something like that, in that range. It's going to vary. But what can happen is that initial kind of wave of fear and that initial, the fight or flight response really kicking in, it will, it'll peak and it'll kind of start to subside, start to go away. And on occasion, though, what can happen with a panic attack is that it'll start to go away, and then for some reason it'll kind of pick back up again. And so I think that's why some people report that a panic attack can last hours or perhaps a portion of the day, is because what's going on is it's peaking and then it's starting to come down a bit, and then for some reason it's picking up again. So symptoms, those are symptoms, kind of how long a panic attack may last. So the rest of this presentation is about how to cope. If I am experiencing a panic attack or an anxiety attack, what can I do to help myself with that? And this particular strategy, it has an acronym, AWARE, aware. And this is a strategy that I picked out from this particular book, Anxiety Disorders and Phobias, A Cognitive Perspective. I want to emphasize this is not the only strategy for helping yourself cope with a panic attack. Um, in class, students have often shared what they have been taught and what they utilize to help themselves. And if it works for you, wow, use it. Keep doing it. There are some steps here that I think are more universal and important. So hopefully this will be helpful to really just about anyone. So the first step is that acknowledge and accept. And let's take a look at that. So this is a really, really important step. And if you are only able to do one of them, I kind of think this would be the most important one. So the idea here is that if you feel sensations that seem to indicate that a panic attack could be happening or that it might happen. So for me, that would have been that sensation of warmth or heat coming up through my body. What is recommended is to just accept it. And accepting or acknowledging might look something like this. It might be, I'm noticing that heat coming up through my body. Wow, it's possible I might have a panic attack. So the idea is accept it versus fighting it. If you start fighting against a panic attack, there's a tendency for it just to get bigger. There's an expression, what you resist persists. And so, we don't really want to resist it or fight against it. It's more so about accepting it and just allowing it to move through your body. And this kind of goes against the grain. When we are feeling something that can feel frightening and scary and unpleasant, there is just this kind of part of us that wants to fight against it and try to push it away, make it go away. But that actually can increase the intensity or the duration of a panic attack. So learning to just acknowledge, accept, and allow it to move through your body. So maybe this will help also if you understand what a panic attack actually can do to you. Although it may feel like you could die or you're not able to breathe, um, you're going to be okay. A panic attack, what it will do to you is it's going to make you feel afraid, and you know that's about it. You're going to go through hopefully a really short period of time where you feel really comfortable, really uncomfortable. The thing is it's going to pass, and it'll pass more easily if you just accept and allow it to happen. Um, and this, I think, is always reassuring. When you are having a panic attack, the worst has already happened. Just write it out. Yeah. And I've mentioned this. Why should I accept a panic attack? Well, the more I resist, the worse it tends to get. Okay, so the second step in this aware strategy is the W, and the W stands for wait and watch. And the idea behind this particular step is this: give yourself permission to do whatever you need to do at that moment, um, you know, to feel better. So rather than continuing to try to push forward with whatever you might have been in the process of doing, wait. Okay, maybe at this point you need to sit down or lie down or go outside or get a glass of water, or maybe it's take that sweatshirt off because you're feeling warm. So just wait, give yourself a break, don't try to push forward. Also, it says give yourself options, don't lock yourself in. I remember it was the last time I had a panic attack. It was when I was actually in the process of getting ready to make a 2-hour drive to catch a flight. And it was really important, in that case for me to allow and give myself options. Um, I can reschedule my flight and take a later one. I could leave a bit later and just see if I happen to still make the same flight. If I had been telling myself, I need to hurry up, I've got to get in the car, I've got to leave now, that would have probably generated more panic and made the panic attack worse. So, in this wait and watch stage, give yourself options, give yourself time. And while you're doing that, also, this is the other thing that, it can initially feel kind of tough, but this helps. Just watch and observe how the panic attack works. Note your bodily sensations. And I've had other students tell me that what they do is they begin to notice something in their environment. And what this does is it can kind of get you out of your head and the worry and the fear and get you more into the moment and noticing different colors of the rug, or it can be a variety of things. I personally, I just observed symptoms. I would and name them: heat, warmth, sweat, and doing it also in a really calm way, kind of matter of fact way. This stuff takes practice, and but especially, with that first step, if you can get that first step down, everything becomes, I think, much easier. So the third letter in the acronym is another A. Now, this one is related to actions and how to talk to yourself. So I mentioned some of these actions this last time, or with the W, with the wait and watch. The idea, though, with this action step is um, all your only job really at this point is to take actions to help yourself feel more comfortable. And I want to stress this strategy is not about trying to make the panic attack end. That's going to happen no matter what you do. This strategy is more about how to make yourself just cope with that process of moving through the panic attack. So, it could be any of those things that I mentioned: sitting down, lying down, going outside, belly breathing, deep breathing. This is excellent to put into practice at this point. Get involved in the present. I mentioned that, it could be noting the physical sensations or noting something in your environment. Um, Reassuring yourself that it's natural and that it's okay to feel afraid and that you will be all right. So, actions are all about how to make yourself more comfortable. They are not about trying to make the panic attack end. That's moving more into this fighting or resisting the panic attack, which will, again, it'll make things worse. So we're going to move along to that second R now, or I guess the first R, A-W-A-R-E. R, this is repeat. And this is here just because of what I explained earlier. Sometimes with panic attacks, it'll feel a bit like it's beginning to go away. The intensity of the symptoms will start to subside, but then for some reason, you might experience just another wave of panic. And if this happens, it's not unusual. It just happens sometimes. It's not dangerous. It's also not because you did something wrong or that the strategy isn't working. That's just the way that some panic attacks happen. And so, if you do feel that second wave, you just repeat. You go back to the beginning, um, acknowledging and accepting. It's like, okay, well, it feels like I'm having another wave. Okay, I'm just going to wait, give myself time and watch, note the bodily sensations. I'm going to take actions to help myself feel more comfortable. So that repeat stage is in there just to remind us to go back to, acknowledge, and accept. And then the final letter E in this acronym, which is usually everyone's favorite step, the end. Your panic attack will end. All panic attacks end. And I'm just going to read this to you. It's not your job to make the attack end. Your only job is to make yourself as comfortable as possible while waiting for it to end. So, this, I think, if any of you are, experiencing some problems with anxiety attacks or panic attacks, hopefully this has been helpful. I do want to say once again, it's very important to see a doctor and, to have a doctor look you over and make sure that you are all right physically. If you're experiencing challenges with anxiety, if it's interrupting your daily life, if it's making it hard for you to get out and about, if it's really upsetting the quality of your life, again, see a doctor, see a professional, and ask for help. Be sure and be honest about what you're experiencing so you can get the right help. And something that I'll share with you, um, I um, I was diagnosed with an anxiety disorder in my well, really I was about 40 when it happened. And some of you, if you have problems with anxiety, may wonder, is this permanent? Is this the way I will always be? And I'll share with you just my experience is that for me, the real strong anxiety disorder has not been permanent. Um, it was with me in a pretty strong way for about 10 years. And then the next 5, I was slowly noticing that I was really feeling better. And, just maybe in the last year or two, I've noticed that for the most part, not completely, but for the most part, that's something in the past for me. However, I do know that I'm a person who will always need to really pay attention and take care of myself. Really, everyone should do that. But, I was given this kind of a gift, I guess you could say, of an illness to kind of wake me up and go, gosh, I've got to start really doing a better job taking care of me. So yeah, I think taking care of oneself takes on a new meaning if you've ever experienced an anxiety disorder, and it is something that you probably need to commit to doing that for the long haul. But my experience has taught me that if you take all the actions that are recommended to help yourself, um, quality of life can definitely improve. And, you know, this is a condition that you can really get out there and enjoy life with. Takes practice, takes some time, but it's important to just stay the course and keep doing what you know will help you out. Okay, so hope you all have a really, really good day, and I will talk to you soon.